Good afternoon, everyone, and it's now 1 p.m, so let's get started with our webinar today. Welcome to this policy research webinar with Nicole Capper and James Mole from the Australian Bureau of Statistics. Today we're looking at getting LGBTIQ plus diversity into data. Can the ABS standard help transform LGBTIQ plus policy and planning? My name's James Zanotto. I'm Director of Policy, Research and Communications here at LGBTIQ plus Health Australia, and my pronouns are he, him. LHA acknowledges the traditional custodians of country throughout Australia, their diversities, histories and knowledge, and their continuing connections to land and community. We pay our respects to all First Nations people and elders past and present. I'm joining you today from the land of the Gundungurra people here in the Southern Highlands in New South Wales. Please feel free to use the chat function to share the land on which you are today. Before we begin, I'd like to mention a few housekeeping items. Our webinar today is being recorded, and I'm actually not seeing the record on at the moment, so if you can give me a moment. Yes, excellent, we're running. So just be aware that if you miss any information, you are able to watch it once it's on our website in a week or so's time. After our discussion, there'll be an opportunity to ask questions. I invite you to use the Q&A function, which for most Zoom users is located at the bottom of your screen. Please feel free to ask questions at any time, and we'll come back to them after the presentations. And if anything in today's webinar raises concerns for you, support is available. You can contact QLife, which provides Australia-wide anonymous support for LGBTIQ plus community members. QLife services are free and run from 3 p.m, available by both telephone and web chat. 1800 184 527 or visit qlife.org.au. On that note, let's begin. Most health and wellbeing data collected in Australia does not adequately count LGBTIQ populations. This results in a lack of information to monitor and report on national strategies and insufficient data for national, state, territory and local level targeted policy programs and service delivery. From 2018, LGBTIQ plus Health Australia, representatives of community-led organisations and researchers collaborated with the ABS to advise on appropriate questions in the 2021 census. While the former government ultimately didn't include questions in that census that were adequate, in January 2021, the collaboration resulted in what's known as the ABS 2020 standard. It replaces the former Standard for Sex and Gender Variables 2016 with updated sex and gender variables, as well as new variables for variations of sex characteristics and sexual orientation. Used together, these four variables, sex, gender, variations of sex characteristics and sexual orientation, can provide comprehensive data on LGBTIQ plus populations. The standard is being progressively adopted, and the ABS today will talk about some of its implementation work. So welcome, Nicole Capper and James Mole. Nicole leads the Community and Family Statistics team at the Australian Bureau of Statistics. In this role, she champions better data and insights about LGBTIQ plus community through the implementation of the standard. Nicole's career spans a range of social statistics, including crime and justice, census, family and household statistics, as well as working with clients on measures of household outcomes for Aboriginal and Torres Strait Islander people and community. James leads the social characteristics team at the ABS. In this role, he focuses on better data and insights about the LGBTIQ plus community through the implementation of the standard. So A reminder as I pass across to Nicole, who will speak first, you can use the Q&A function for any questions, and we'll come back to them after the presentation. So welcome, James and Nicole, and let me just get your presentation up on screen for you.
Thanks very much for that, James. I'll wait till it comes up and then I'll start chatting.
Here you are.
Thank you very much. Firstly, I'd like to say hello and thank you very much for your time for coming and chatting with us today. My name is Nicole Kappa. My pronouns are she, her. I am the Assistant Director within the Social Characteristics section, and our team is the custodians of the Standard for Sex, Gender, Variations of Sex Characteristics and Sexual Orientation, as well as the family standards as well. So that's a part of our role. So when I'm referring to our standard, so the the sex, gender variations of sex characteristics and sexual orientation standard, I'll probably refer to it as the standard because there's obviously a lot of words in there. Or else alternatively, we refer to it as the 2020 standard throughout the presentation. So firstly, I would also, sorry, James, I'll get you to go to the next slide, please. Thank you. I'd like to also acknowledge the traditional owners and custodians of country throughout Australia. The ABS recognises their continuing connection to land, waters, and community, and we pay our respects to their cultures and elders, past and present. I'm coming to you from Meanjin in Brisbane, and the people I would like to acknowledge in particular are the Turrbal and Yagara peoples, and obviously all of those across Australia from where you're all joining us today. Next one. So some of you may and some of you may not have attended some of the webinars that we've run in the past. So I'm going to spend a bit of time with you to talk to you about the standard, where we've come from and where we are now. I'll touch on some of the questions that we ask and some of the rationale behind those questions and some of the ways in which you can get best information out of those questions as well. And then I'm going to pass over to James, who will chat to you about one of our most recently released surveys, which is the National Study of Mental Health and Wellbeing. And he'll drill down into a little bit more of the data that we've been able to provide information around. And he'll also touch on some of the future releases and next steps, and some of the reflections that we've had from implementing the standard within the ABS as well. So we'll move on. Yep, thanks very much, James. So the 2020 standard replaces the previous 2016 version. So our 2016 version was much more basic. It only included data around or questions around sex and gender variables, whereas now we've introduced variables for variations of sex characteristics as well as sexual orientation. We've also been able to introduce a classification or a derive that we produce cisgender and trans and gender diverse variables and output for as well, which is great. We also, throughout the standard as well, recommend the use of inclusive language or, inclusive language, gender inclusive language. So the outcome of this particular stand was the result of not just the ABS going off and forging a path on its own. We liaise with a lot of stakeholders across a variety of different arenas. So LHA, obviously a part of it, some other members from the LHA network, such as ACON and Intersex Human Rights Australia, to name a few. We also engage with a lot of researchers and academics, as well as Attorney General's Department, Human Rights Commission, and the Institute of Health and Welfare from a government perspective. The key drivers for the standard were obviously representation. We need to be able to collect data about the different communities within the LGBTIQ plus space. Data need. There's, like James represented up front, there's limited data on this population or on these populations. And we wanted to be able to capture that in a nice, consistent way that is able to be compared across different vehicles, essentially. ABS plays a role in statistical leadership. So creating a standard from the ABS is usually seen as best practice because it's something. Sorry, I'm just having a little look at a note from James. Hopefully, you can hear me okay. Um, yeah, so essentially the ABS consults quite broadly, so with other national statistical organisations across the world to look at what's best practice and what they're doing out there in the world as well to understand how best to shape a standard. And then that feeds into international comparability with that sort of research and implementing something that's fairly comparable across countries. We can produce some comparable statistics. So, just broadly about ABS standards in general, I just thought I'd give you some valuable insights into why the ABS develops standards in general. So, a statistical standard is a set of guidelines which standardizes, obviously, the way data is collected, processed, and released for a particular variable. As I mentioned previously, having a standard allows for comparability, and then it also allows for obviously harmony of the way in which people are interacting with questions and the way in which we can output questions and then use different administrative sources or survey based sources to be able to compare and feed into a better picture or a larger, broader picture of what is happening out in the community. It helps with understanding and interpreting data, so that sort of feeds into that narrative as well. Statistical standards are used to ensure, yep, comparability, harmony. Now I'm reading my notes. Sorry, I've just been blah blahing and now I'm reading my notes. Um, what else is there in there that I think I need you to hear from me? Um, they also provide information to internal and external users on how data is collected. So it sort of shares with people how did we actually get to this data that we've output here? These are the types of questions asked, and it can kind of give you a bit of an understanding of what the limitations might have been around the questions as well, or the benefits to the questions. Constraints of the standard are obviously that it can't provide a person's whole story. We are actually just trying to understand specific aspects of what a data need has defined as being required so that we can then sort of collect that information in the standard. Um, and it doesn't detail how to represent the data in publications, so the output side of things, or in commentary. That's something to work through from a data need perspective, and also from what it is that you're trying to collect that will inform those sorts of information pieces of the puzzle. So the next slide, I'm going to give you a glance because some of you may have already seen these and have interacted with these quite thoroughly, hopefully by now. The standard's been out since January 2021, so it's been around for quite a bit of time now, which is great. So the four main questions that we advocate the use of are sex at birth and gender, obviously. So these are the updated versions from what we had in 2016. So in 2016, we had a question that was, are you male or female? So that was very limited, obviously, in its application and in its sharing around what it is exactly that we're trying to collect here. Whereas this particular question, sex at birth, is much more specific. So we're asking what a person's sex was recorded at birth. It also allows male and female and another term, and it allows people to do a write-in at the moment in their standards. So the intent behind this one is to try to capture information around what was recorded and reported in a person's birth registration, essentially. Um, then, obviously, we've got our gender question down as the next one there, and it asks, how do you describe your gender? It also has a little bit of extra language in there talking around gender refers to current gender, which may be different to sex recorded at birth, and it may be different to what's included on legal documents. And then we have a longer list to what was provided in 2016. So 2016 only had binary options. This time round, we've provided non-binary. We've also allowed for people to offer up further detail if those particular response options that are included there are not meaningful to a person who's responding to the question, so they can provide a write into it. And obviously also allows people to say that they would prefer not to answer if that's their choice. So a bit more flexibility, a bit more representation, allowing to be placed into that gender question. Sex at birth and gender, we recommend where survey vehicles allow or where data collection vehicles allow, having the two of them packaged up together. So have sex at birth and gender, where possible, have them on the same screen so that a person that sees sex at birth as a question goes, I can't answer this, or this is no longer relevant to me. They can then see that there's a gender question following it. So that allows people to see that we're trying to capture a person's lived experience and sort of from go to woe or go to now in these collections of questions. Sometimes in the standard, actually, we've got a bit of text that also allows for people to place in there under the sex at birth question, a question relating to gender will be following. So that sort of just highlights up front that this is not going to be the only question that's going to be asked. Yeah, so I think that's probably everything in these two questions. I'll circle back to those two questions shortly, just to give you a bit more information and context around how we derive our cis and trans and gender diverse population. But in the meantime, the new questions that we've added into this standard are variations of sex characteristics. So it's explicitly asking, were you born with a variation of sex characteristics, sometimes called intersex or DSD? And it provides obviously those 4 response options: yes, no, don't know, prefer to answer. The reason this is a question of its own is we did a lot of stakeholder research and engagement around best practice to capture this population. We understand and acknowledge that it's not appropriate to be collecting it within a sex question. And the reasons for that is that people respond to a sex question differently. Some people will identify as the binary sex that they are living, and some people will respond to offer up more further information about their variation of sex characteristics in another term, please specify field. So it's not being answered consistently. So it's not giving us a decent understanding of what the population counts are. So best way to do it is ask a separate question specifically related to the population. Sexual orientation. This question has previously been asked within the ABS in the General Social Survey in 2014 and 2020, and it was also asked in one of our personal safety surveys previously as well, but it was not a standardized approach. So we've now standardized it. We've got our question here, how do you describe your sexual orientation? And it allows for straight, gay or lesbian, bisexual, I use another term, please specify, don't know, and prefer not to answer. So the standard also acknowledges that there will be need to collect gay or lesbian as separate variables. So it says if that's a data requirement, then go right ahead and do that. And it also allows for further response options such as asexual, pansexual, or queer to be included in your pick lists as well. The things to note around adding more variables or response options is that the more granular the response options are, the harder it is sometimes to be able to output that information. And you either have to aggregate it up or you can't output it because of confidentiality reasons. So they're things to consider when applying this in a survey setting. Next slide. Is around, as I mentioned earlier, the cisgender and trans and gender diverse classification. So we've developed this in response to a growing requirement to be able to capture and output data around our trans population in Australia. The way in which we derive this is we ask the sex at birth question, as I mentioned, those 2 slides earlier, the sex at birth question and the gender questions, because we can then look at the response options to both of those. So for a cis person, obviously they'll respond. So for myself, for example, just using myself as an example, sex at birth, female, gender, woman, female, and then we can see that that my gender is the same as my sex recorded at birth, and it's the binary option. Therefore, I'm going to be placed into a cis count for output. Trans is obviously where a person's gender is different to their sex recorded at birth. This is something that we've heard some feedback on around people's comfort levels around answering a question for sex at birth and gender. It's acknowledged that it can be challenging for some folks, and we balanced the idea around asking these questions. A, it's been something that's been done in other countries, but B, we were also finding that offering up a question around a trans specific question, we were again coming up with the issue where people may or may not answer it, so you're not actually getting a holistic capture of the population. Yeah, that's pretty much everything there from me. I will hand over to James now, who will run you through some really exciting stuff that we've been able to glean from some surveys that we've run recently. Thanks very much for listening.
Thank you, Nicole, and thank you, James. So my name is James Mole. So I work with Nicole and others in the team on our implementing and supporting a whole range of areas within the ABS to implement and use and output data using our 2020 standard. So it's close to our heart, and we're pleased to be able to share and talk to you today. So, and we appreciate the questions which are already in the Q&A, so please keep it up. So since the standard was updated and implemented in 2021, the ABS has been gradually and systematically implementing and picking up the standard in household surveys as they have been conducted, and particularly with a focus of surveys in the health and wellbeing area. So the 4 surveys which I'll draw attention to today in terms of surveys that have implemented and used the questions that Nicole talked through. They're the ones which I'll focus on today. So first cab off the rank was our national study of mental health and wellbeing. So this was conducted over a period between 2020 and 2022. It went out to approximately 17,000 households and collected a whole range of information, very detailed around mental health disorders and other indicators of mental health and wellbeing. The main results of that were released in October last year, and the ABS did release some analysis last month with some analysis focused particularly on the LGBTIQ+ population. So I'll talk through some results for that in a moment. The next cab off the rank in terms of surveys implementing our standard was the National Health Survey. So this was conducted in 2022, went out to around 13,000 households. And like the National Study of Mental Health and Wellbeing, it did ask all 4 questions: sex recorded at birth, gender, variations of sex characteristics, and sexual orientation. Our survey of disability, aging and carers, conducted in 2022, included 3 of the 4 variables. So it did not include variations of sex characteristic, but included and collected sex recorded at birth, gender, and sexual orientation. And then most recently, our National Nutrition and Physical Activity Survey included all 4 variables as well. So we've got data released for the National Study of Mental Health and Wellbeing and the National Health Survey, and data yet to be released for the disability, aging and carers, and the nutrition and physical activity survey. So I suppose this is the start of our journey within the ABS of implementing and using this. So, and Nicole and I, we will, I suppose, share some reflections from our team in how the ABS has been navigating the implementation and use of this standard. So a bit of a focus on the national mental health and wellbeing. We're excited to see some data that was released in an article last month. So this was the first collection to use the full standard in all 4 questions. Data was collected over 2020 to 2022. And it's a very detailed question that goes through a whole range of diagnostic instruments, which are internationally comparable, and fit within World Health Organization guidelines. Fortunately, the sample size was not large enough to be able to support reliable estimates for some of the population groups of interest. So people who reported a sex at birth as another term, as well as those with a variation of sex characteristics. So we didn't have sufficient sample to be able to have reliable estimates from this collection alone. So we'll move on to the next slide. It's almost just a bit of a note that the data from the survey may cause distress for some people. Nicole will put in a link to the analysis from our ABS website shortly. But yeah, I suppose support services are available. It's confronting information, but it's important information both for policy development, evaluation, as well as for all of Australia and the community to know and understand. So these graphs on the page, I am a statistician and I can't do a presentation without graphs. So please appreciate that. So these graphs are from the article and the analysis that was released last month. The analysis does include a range of mental health and wellbeing information collected in the national study. I'm just going to highlight some of the data, and that's mostly people who have reported a mental disorder in the 12 months prior to being interviewed. And when we say mental disorder, this is defined and based on World Health Organization outlines, and essentially refers to anxiety, affective or substance use disorders that people have reported. So it's used in, I think it's called an ICD-10 for people who are familiar with that. So I'm just going to focus on the information on the right-hand side of the graph. The survey and the study asks about lifetime prevalence of disorders, as well as within the 12 months prior to being interviewed. So I'll just focus on the figures in the right-hand side of the graph. It just shows proportions of people who reported one of those disorders, either anxiety, affective, or substance use disorders, 12 months prior to being interviewed. And this is showing the prevalence by sexual orientation. Just let people take that in. I think the short takeaway here is that we had almost 3 in 5, so almost 60% of lesbian, gay, or bisexual, or those with another non-heterosexual term, reporting a 12-month mental disorder in the previous 12 months, and that compares to around 20% for heterosexual people. So it's a very significant difference. Our next slide shows the similar kind of thing, but essentially for by the gender question that Nicole talked through before. So it shows the information for men and for women and those who reported a non-binary gender. So you can see the large bar probably on the right-hand side again, showing the 12-month disorder. This time we can see 4 in 5, it's 80% of non-binary people had a 12-month mental disorder, compared with around 1 in 5 for men and women. Then our final slide shows a similar information, but for our gender experience, so cis or trans identity, based on that classification that Nicole talked through earlier. So here we can see the proportion of trans people. I'm focusing on people aged 16 to 34 with a 12-month mental disorder was almost twice that of cis people of the same age. So that's almost 60% compared with just over 30%. So I think there's hopefully more information in that article, and this is, I suppose, a bit of a really good exemplar of the standard at work and some of the data and the information and insights that can come out from the ABS implementing our standard. This is not just the information that's going to be released as well. So ABS is currently working to combine our survey samples from a number of those surveys, which I talked about earlier. So the National Study of Mental Health and Wellbeing, the Australian Health Survey, the National Nutrition and Physical Activity Survey, and Disability, Ageing and Carers. So what the ABS is doing, it's combining or pooling the data and the sample of people all together into one big data set to create a bigger data set to have some more reliable estimates to be able to provide and release for estimates for Australia. So this will provide some population prevalence estimates for sex, birth and gender, sexual orientation, variations of sex characteristics, as well as the cis and trans population. So this work's currently underway, and we're excited to hopefully see it released around Q3 of 2024 at this stage. I did notice a question earlier in the Q&A regarding the census, and that's a really key collection for the ABS. So it's our hallmark, 1 in every 5-year data collection where we get to go out to all of Australia and ask a very small number of questions to get a really good insight into how many people are in Australia and also what our society looks like. So work is currently underway for planning and planning and working through details for the 2026 census. So it's a long process to work through and plan. Pleased to say that of the new topics being considered for inclusion in the next census are the topics of gender, sexual orientation, and variations of sex characteristics. So our colleagues in the census area of the ABS have been undergoing and undertaking some very extensive public consultation. Hopefully some of you have been either aware of that or involved in that or provided a submission. So the outcomes of that consultation found really strong public value in the census collecting these topics, and recognising that sex is already collected as part of the census as well. So strong public value for all 4 of those topics. We're also pleased to say that the 2020 standard has provided a really strong starting point for the census area to do testing of these questions in a census context. And when we talk about the census context, I suppose hopefully all of you would have reported and responded to a census at some point. Something where it is self-report, so we don't have interviewers. It's something where often one person might be asked to provide information for everyone in the household, or sometimes people will pass the form through. So it is conducted in a different way to some of those other household surveys that I talked through earlier. ABS is currently testing the topics to understand the data collection in the census context. And we're also working closely with a LGBTIQ+ expert advisory committee for the 2026 census. So that includes a whole range of experts and informed people to provide advice to the ABS as we navigate that. Unfortunately, I suppose maybe not unfortunately, but we don't quite know what will be included in the 2026 census at this point. So the ABS is still working through what it will be recommending to government. And the Australian government does make final decision on content for the census, and it always has. So ABS will be making recommendations to government probably mid this year, and then government decision will take place after that. So we're all waiting with bated breath for the outcomes of that. But I think Nicole and I, the team, we've been able to see the benefit of the standard in putting these topics, which have been assessed as having high public value, having them in as good a position as possible for inclusion in the census. Okay, on to reflections and challenges. So I might almost open it up for Nicole to join me as well, if you're happy with that, Nicole, because I think you've probably got just as many insights and reflections as I do. So our first one is around question placement. So Nicole did talk about the sex at birth and gender question, and I suppose the recommendation and the benefit of having both of those questions adjacent to each other when they're presented to survey respondents or people in a question format. And that's something that we've really seen either in collections which haven't done that, or collections which have only collected one and not the other. So I can really see benefit of people being able to see the context of being asked sex, but also having the opportunity to report and provide their gender as well. Sample size implications. So something we touched on earlier was the challenge in being able to provide reliable estimates. And I suppose when we say reliable, it's making sure that our survey sampling errors are sufficient enough to be able to provide good data of high quality. Sometimes for some surveys, we're not able to provide estimates for all population groups, but I think that pooling project, which I talked about before, where we're combining the sample sizes or samples of multiple surveys, provides an opportunity to be able to overcome that. Confidentiality and safety. I might let you speak to this one, Nicole, because I'm almost out of breath.
Sure. Hopefully my dog doesn't decide to bark at things that are going on outside. So confidentiality, obviously the ABS is bound by confidentiality. That's one of the most critical elements, and that's what keeps us going, is that people feel safe to answer our questions, knowing that they will not be identified. So where responses to certain questions or certain response options are a smaller population, it's really important to be able to collapse or aggregate them up into sort of broader categories, and then be able to explain in footnotes, for example. So as you would have seen in some of the things that James presented earlier, there was the field of use a different term, different identified with another term or something like that. I can't remember. Sorry about my brain's not working. So essentially being able to sort of highlight, well, these are the types of responses that were included within that broader category. So asexual, pansexual, and queer, for example. So rather than pulling each of those responses out individually and not being able to provide any data about it whatsoever, that's the choice that we made to do, is to sort of group them together and then sort of show, this incorporates this number of people across these various types of identities. Sorry.
Thank you, Nicole.
Yep. Speaking of out of birth.
Education and training. So, and I think that covers a couple of aspects. So one in particular is, the training and the education for the ABS's interviewer workforce. So for some of our collections, particularly in the health space, the ABS does use a panel of interviewers. They knock on doors and they interview people in a personal interview sense, whereas other surveys are more self-reporting over the internet or over the web. But we're finding with the interviewer panel the benefit and the importance of education and training all of our interviewers so that they're fully aware and fully across the concepts and the information around what we're collecting, and also have that understanding of lived experience of a whole range of population groups. Also extends to, I suppose, education and training for the community and for the respondents as well around what we'll be asking and what we're information around the concepts that we're asking about. I suppose this is goes beyond the education and training just on the topics that we're talking about. In the health space, I suppose it includes education and training around concepts of mental health conditions or physical activity. So I suppose it's a couple of aspects that we find really, really important, both from our interviewers who are interacting with our respondents, but then also for respondents themselves. Processing and output considerations. I think that's something that is really coming to light now that we've got some of the surveys being collected, and teams are now working through the making sense of the data and working out how to present it and analyze it, as we saw in the survey of mental health article that was released last month. So I think we've got considerations there of how to present and how to explain the data, which doesn't always necessarily doesn't always fit with the input side of asking about sex, asking about gender, asking about sexual orientation, asking about variations of sex characteristics, which are very question orientated. So how do we bring that out and uncover the story behind that?
Thank you both. Nicole and James, we're slightly over time, but I've got two questions that have been sitting waiting for quite some time, and I hope you can stay with us long enough to at least respond to those two questions. One of them's actually quite a technical question. I think you can probably see it on your screen, and I hope you've had a chance to think about it. But the question is, I've been looking at the standard, but wondering why, if someone chooses not to disclose their sex assigned at birth, but says that their gender identity is non-binary, why is that individual classified as inadequately described? Whereas in many communities, a person who is non-binary is trans, as non-binary is not an option on a birth certificate. So I guess, first of all, is that the right interpretation of the standard? And if so, can you talk about the thinking behind it?
Yeah. So that is the correct interpretation of the matrix around that we've provided there for the cis and trans derive. And whilst it's changing, sorry, I'm just trying to get my head wrapped around the last sentence. A person who is non-binary is trans, as non-binary is not an option on a birth certificate. Yeah, so basically we've kind of had to keep it quite technical in terms of looking at the way in which Australia and internationally people collect information on a birth certificate, or how people register sex on a birth certificate, because that's what's collected on a birth certificate is sex. So that is changing, I'll acknowledge. That is actually changing in some states and territories. But historically, it was male, female, and they had what is now considered not an appropriate way to collect, but indeterminate, intersex, and I can't think of the third one. Sorry, excuse me for not being able to bring that to mind. But essentially, we were working off what is available on a birth certificate. So that's what that sex question is sort of trying to target. And then if you go internationally, there are folks who do collect more detailed information around variations on a birth certificate as well. So it's not entirely perfect, but it is what we are working with there. I hope that answers the question. If it doesn't, feel free to clarify anything that I've missed in there. Sorry.
Thanks, Nicole. And James, just a quick question from the chat. I think it was on your slide, but what's the sample size for the population of the 2020 to 22 mental health surveys?
I'm just looking at that now, actually. So I think so on
There,
the slide, we've got 17,000 households in the study of mental health and wellbeing. I'm just trying to see if I can find some more
I'll get you
information
the people number.
to either
Sorry.
confirm that or just check how many people that refers to. So I'm just trying to have a look at.
I do have that
I think it
detail.
equates
Sorry.
to, I think it's almost 30, yeah, 15, 16,000 fully responding people in our sample for that study.
okay, thank you, James. And the final question, and then we'll wrap up. Interesting one. Was there much discussion about using the term straight and its implications? Could it have led with heterosexual?
It's a really, really interesting question, actually. And I I think it is something to note that I think straight resonates for some people in society, but not for others. And also the term heterosexual resonates for some people in society and not for others. Um, and I suppose what the standard has done is it's included both, so that people who may not know what heterosexual means or may confuse it with other terms can also see straight there and vice versa. I think certainly what the team found through testing in development of this standard was the need to be able to ensure that the questions and the words in the responses are well or can be as understood as by as broader subsection of society as possible. So we're thinking around people whose English may be a second or third language, people who may have recently arrived in Australia from overseas or from different cultures. And I think testing has shown that understanding of some of those terms does differ across some of those population groups. So, and even internationally, I think we can see that, like comparable countries such as Canada and the UK, in terms of we often and New Zealand as well. They often use both terms as well, rather than just using one, straight or heterosexual. So hopefully that answers that question. But I think it's a really interesting question.
Thank
Nicole, I don't know
you.
if there's anything else to add.
Thank you, James and Nicole. Knowing we're over time, I'd like to wind that up there and thank you both very much. I'm really excited to see the standard increasingly being implemented. I have to say much of what we're seeing so far, we kind of already know from the work that's been done, but it's wonderful to have official data from Australia's official agency to actually confirm it so that when we're talking with government, we have a solid ground on which to stand and to do our planning and discussion. So thank you for sharing with us today and thank you for the work. For everyone who's with us, we have a brief survey on our webinars, which I've put into chat. I hope you can give us some feedback and some thoughts. And on that note, we're having a brief break in our webinar series. I hope that many of you will be attending our conferences next month, Health Indifference in Canberra, and our Aging and Aged Care Conference virtually online. And when we've recovered from those conferences, we'll be back for a new season of webinars. So thank you all. Have a good afternoon, and we'll see you next time.